Live from New York, it's Benefits with Friends. I'm your host, Lou Bernardi. Thanks for joining us today. We have a great show today for you. A good friend of mine and an excellent benefit advisor from down in sunny Florida, Dennis Hartin, is going to be with us. It is Cinco de Mayo, so a day that's near and dear to my heart. My name's Lou Bernardi. For those of you who are joining for the first time, I wear these ridiculous boo shirts because I am the Benefit Optimization Officer. A reformed benefit broker consultant, my 30th year of business, and just really invigorated and excited with the kind of the new world of benefits and healthcare that I've become exposed to for the last 5 years. And I guess it was probably about 5 years ago that I met Dennis for the first time, maybe three or four. So let me bring Dennis right in to the stream. Here we are, Dennis Hartin.
Good afternoon.
From sunny Tampa, I think.
It is. It's a bright, balmy. I don't know. We're probably about 85 right now. It is beautiful.
Yeah, it's it's a nice day in New York. It's a nice spring day. It's probably about 70, maybe a little bit warmer. I've been in the office since about 8:30, but it started to change. I might even open my pool in the next couple of weeks and just look at it for 2 months.
Nice.
But because it'll still be 60 degrees. But anyway, thank you so much for joining me today. It is Cinco de Mayo, but it's also Mental Health Awareness Month. So I think when we connected a couple of weeks ago and I asked you if you'd like to be on the show and you brought up the topic, I don't even know if you were thinking about it. I know it's something that's near and dear to your heart, but it is Mental Health Awareness Month, and that's the main topic of conversation today. For the call. I'm just going to bring a slide up here. So anyway, the point of the show is really just try to help benefit decision makers. Could be advisors, right? HR directors, CFOs, anybody involved with the benefit decision. I think, what I've realized, and perhaps you did too, Dennis, is that, managed care is very complicated. It's been around for about 30 years or so. And while it was pretty easy early on, and it really changed consumer habits very quickly because financially it was very enticing. You went from, maybe a $250, $500 deductible under an indemnity plan years ago to a $2, $5 copay. So even though it was complicated then, and it's still, it's much more complicated today, probably, there was a financial incentive for the consumer to embrace it. And they did, But 30 years later, we've kind of become very uninformed consumers. Everybody, if you ask them, says healthcare and health insurance are way too complicated. So, the idea of this program is just really kind of share what we've learned, right, by taking a look behind the scenes of healthcare and health insurance. 5 years ago, when I was primarily a general agent, our agencies existed for 25 years, but I was a GA selling insurance. Primarily, I was focused exclusively on the insurance, and then I had the opportunity to see behind the screen or under the hood, and I really couldn't believe what I saw and how people say it's broken, but I would argue that it's not broken. It's working exactly how the managed care system wants it to work because we're uninformed consumers. So that's a big part of what this silly show is about, because what I've thought is, and there's probably a lot more than this, but there's 8 core issues with traditional health insurance plans. Is a lack of price transparency, a lack of quality transparency, low provider patient engagement, 30% or more markup in prescription cost, healthcare steerage, misaligned incentives, no control of the plan document, and unnecessary care. And I guess you'd add to that, as we kind of get into this conversation, is there's just so many people with exorbitant out-of-pocket costs that they avoid care. And that's really, the real big problem is you got a lot of people walking around with an ID card, but they don't use it because they don't understand the system and they don't get the care that they need. And actually, I'm going to bring this back up again and, kind of get us into this conversation. So, why are we talking about this? Obviously, mental health, behavioral health is part of healthcare. And I would hope that most employers that are purchasing healthcare, making that investment in their people, are doing it because they want that to lead to the best healthcare for their employees. And mental health is kind of one of those situations, right? It's highly protected from a privacy standpoint. Most employers don't see the claims of their members. But this is what the data tells us, right? So the data tells us that 1 in 5 Americans has some type of mental health or behavioral health condition. It could be, you could probably roll substance abuse, into that, potentially. Spending on mental health treatment and services reached $225 billion in 2019, probably 230 or 40 billion today.
Yeah,
that was an increase from the 10 years prior to that of 52%. Therapy, prescription medication, inpatient, outpatient stays, accounted for most of that spend. But then there's also the indirect cost for an employer. Also, is 44 billion is the estimate in lost workplace productivity, and that could be absenteeism, or what do they call presenteeism?
Yep.
You're at work, but you're really not there, right? You're distracted. And a typical therapy cost anywhere from $65 to $250. So access to care, big problem. In 2008, mental health parity helped improve the access to care because they mandated, I guess on the federal level, that mental health must be treated as any other condition. Before that, you could have exclusions or limitations or number of visit limitations, any variation of that. Mental health and substance abuse treatment centers, there's a problem with accessibility. A majority of them are in, large urban areas.
Yep.
They're not in rural areas. So a lot of people in parts of the central part of the U.S. might not have someone within driving distance of their home or manageable driving distance, right? So that's a big thing.
Before you move on from that too, that statistic, right? That 56% of psychiatrists accept commercial insurance. We know that's a big issue.
Yeah.
There's hardly any of them around. So when you put those 3 statistics together, what does that, what's the so what, right? I'm always looking for, why does that statistic matter? This is what people don't realize. And even some of the best direct primary care docs that in our industry that are trying to help solve for some of the same issues we are, that have gotten out of the traditional system and they're doing things in what I would consider the right way. They will tell you that because they have patients that are struggling, they're 80%, I think, of the psychotropics are actually being dispensed by direct primary care physicians. Now, I'm not saying that they're not capable of giving out prescriptions, right? But psychiatrists, that's what they're trained to do. But because there's so few of them, you've got doctors who are handing out medications to younger and younger generations because they know they need care, but they can't get in to see a therapist or a psychiatrist. So ultimately, they're like testing them out with these medications. And even the direct primary care docs that I know don't love that situation, but they can't send the patient home doing nothing because it puts them at risk. If that child completes or attempts suicide, imagine the liability that actually does come back on the doctor. So there's way too many of these medications that are being handed out at younger and younger ages. And some of them are serious, very strong medications for, developing brains.
And on that point, I wish I could have anticipated that comment from you, because a few weeks ago, I was on the phone with someone who, it's basically like a form of genotherapy, right? Mm-hmm. It's a swab that people can get done. And I'm thinking about doing it for a family member of mine because several underlying health conditions that the medications over the past 10 or 15 years just haven't worked.
Yeah.
And in that conversation with that provider, both as an advisor and, personally, I was looking into it. The statistic was that 90% of the people who get those traditional medications, it's completely ineffective on.
Yeah.
So the most common medications for mental health, behavioral health, don't work on 90% of the population.
Yeah.
And that's even scarier if you're talking about primary care doctors that are, taking that leap to try to be a resource, giving out those very, very powerful medications. Maybe when it's not the most opportune time to do that, or the right person to do it with. Yeah.
It just struck me because I know words matter. And he said he felt like sometimes it was experimenting with medication. And when you're talking about a kid with a parent who's probably at some level freaking out about getting care for their child, it's a scary position to be in, because I don't think the average population knows where to go or what to do if something happens, right? Or if they happen to see an indication, right? I think about all the indications that are out there that we just don't generally see, right? We're all going 150 miles an hour, and our emails are blowing up like crazy, and we're distracted to the hilt. So how many of us don't even see the symptoms that as they start to arise? And so that's where we've tried to tackle some of this on the front end.
Yeah, no, I can't wait to get a little bit deeper to see what you're doing. I'm just going to give a couple more stats here. So estimates state that as few as 10% of patients with mental health disorder get effective treatment. So I guess that kind of leads into that thing that I just mentioned about the medication just not being the right thing. Another study revealed individuals with behavioral health conditions and physical conditions drive high total health care. So these are not, what they found is these are not two distinct things.
Yeah.
A very high percentage of people with other physical conditions are also suffering from behavioral health condition. And, I was having this conversation in my office today with someone who is familiar, with both, has a, physical and an emotional or behavioral, just needs to talk to someone.
Yeah.
And it's just common sense. When you have a physical condition or something, the stress that can add to someone, right? Besides, because there's varying degrees of mental health and behavioral health, and everybody's under stress. I don't care who you are. There's no one who's got bubble wrap on that's not stressed by, just the world, being a father, being a business owner, being a citizen of the United States, being a citizen of the world. I mean, everything's stressful, right?
Correct.
Unless you live in a bubble. So, but
I've always wondered, we don't talk about it, but I got to think, for a person in their lifetime, one of the top 3 worst days has got to be a day that they either think or they're told they're diagnosed with cancer. And how many people in our world, deal with that on a regular basis, right?
Yeah.
I've got a friend that's going through it right now. And I know the day that happened, when I found out my friend had been diagnosed, that impacted me at some emotional level, right? It's not my illness, but I'm very legitimately facing the loss of a close friend. And I got some news yesterday that, somebody called me and said, "How you doing?" I'm like, you know what? I'm not having the best day. Just genuinely, it's not great. And it's not my illness, but it's a close friend. And I know that's going to impact others. And so that happens every day, but we never talk about, the need for better or mental health care or some insight or education or just some awareness tools on the front end with something like that. And that's going to happen to at least 1 in 3. And I would contend that all of these statistics, every time I see them, I just kind of smirk and smile and think, I don't know how you measure it, because this is like one of those things that's got such a cloak over it. I guarantee you, however they're measuring it, these numbers are probably all low. And they're starting to like balloon. That's what I started to tell you when we talked earlier, is that I feel like we're all like one bad McDonald's order from just absolutely losing it, right? And it's like the smallest things that drive us crazy, and everybody feels like they're hanging on by a thread a little bit. And maybe that's just my circle, but I feel like that's like across the board.
Well, it shouldn't take a pandemic for the discussion of mental health to be really on the forefront, right? It's been a big topic, right? My wife's a school nurse here in New York, and on Long Island, they've been in person all through the pandemic. There was maybe a couple of weeks that they were shut down, and then it was voluntary. But she sees it. She's a K through 6 nurse. She's also the lead nurse for the district. There's about, I guess, maybe 15 nurses because of all the different buildings that they're in and everything. Right. And it's something that they see every day. Lack of this, even though they're in school, there were so many different rules, and I don't want to get into that discussion, but it wasn't their normal expectation. It wasn't a normal childhood setting. It was stressful for them. And you need honesty. Like when you said, "How you doing today?"
Yeah.
People just say, "Oh, great." Because who cares anyway, right? That's the typical answer. Is like, I had one broker, I won't mention his name. Great guy, I love him. I worked with him for about 20 years. And he would start every phone call like, "How you doing?" And I would always say, "Not great," because I knew he never listened.
Yeah.
He'd be like, good, good, before I even had a chance to respond. It was just it was almost like a habit of his. It was just, wasn't listening to himself ask, or regardless of the answer from the other person. Just real quick, one or two other slides. So, one of the things is that when I looked at these statistics, the people with the behavior, let's call them the behavioral health group, people with that diagnosis that also had another diagnosis on top of it,
Yep.
the average spend on their behavioral health treatment, 50% of them spent less than $68 of their cost on behavioral health. A significant amount was spent on the physical problem that they were dealing with, right? And maybe the physical problem is a result of the behavioral health. It's not always you're just stressed because you have an illness.
Yeah.
Sometimes you have an illness because of the stress. So, you can't make that assumption. But here's and I'll pull this down in a second. But this particular study that was done by the Path Forward for Mental Health and Substance Abuse, they studied 21 million members. That's a pretty big population. So it's this should be
it's state of Florida, and
yeah, exactly. Yeah, it probably was. Yeah, right. 10% of patients, and this is you've seen a lot of large claims reports from your clients and stuff, and this is typical. 10% of all of your members or your patients accounted for 70% of your total spend, right?
Yeah.
You could even say a lot of times it's 5% counts for 80%.
Yep.
That top 10% had an average of over $41,000 in claims. The other 90% had less than $2,000 in total spend.
Correct.
So when they zeroed in on that 10%, which is 2.1 million people, 57% of that group were also part of the behavioral health group. They accounted for 44% of the annual total spend. So that's a cross section of that total spend. And in similar results as the other study, 50% of them spent less than $95 on their behavioral health treatment, right? So I'm going to remove that for a second. So, but I mean, those numbers were amazing. When I think about the conditions that we kind of analyze our large groups for, I think about diabetes, I think about musculoskeletal, we look at emergency room and inpatient and things like not really conditions, but just different things. We wonder what's driving the spend.
Yeah.
I personally never really thought of the behavioral health or mental health part of it. And maybe that's because they're kind of hidden in the data within all of those other areas, according to these numbers. It doesn't jump out at you.
Well, that's where, I jumped on that train. I think that book is behind you, right? The CEO's Guide to Restoring the American Dream. We did one of the opioid crisis wake-up calls here very early in my venture, my launch of Hartin Dynamics. And so it's what started me thinking, because of that very topic that you said. You can equate pre-diabetes and intervention at a pre-diabetic to health plan savings before they become diabetic, right?
Right.
70 or even 80% of your health plan spend is something that's by a small population. Take this example. 80% of the spend is actually things that are self-inflicted, meaning high blood pressure, diabetes, smoking. And so I made the connection pretty early, saying, well, if I can catch you as a pre-diabetic and save money, and 80% of these things are self-inflicted, why do people have high blood pressure? Why do they have diabetes? Why are they smoking? Think about all three of those things, in my opinion, are triggers or results of some level of self-medication, right? I'm trying to feel better, so I go have a cigarette. I had a really rough day, so I go out and have some drinks with my buddies. Those things in moderation are no big deal, but over a period of time, over an extended period of time and at higher levels, we see what happens, and we're paying for it in our health plan. That's what people have been saying for years. So they implemented all these wellness strategies saying, well, let's go get you more active. Well, that's great. But if you're literally not in the mental space to get up and go walk, you're never going to improve that. I don't care how strong your wellness strategy is. Let me share with you one slide this is something that I will tell you through my conversations with my friend. Let's see, share screen.
Mm-hmm. Yeah, if you pull it up, I should be able to allow it into the.
All right, so Let me make sure I got the right one here. I'm noticing that it's not showing, but let's see if that.
No baby pictures of Dennis.
Yeah, no, it's not. Yeah. Let's see. Chrome's lost permission to your screen to fix it. It's under my preferences. You know what? Skip that. I'm not going to worry about it. So here's what hit me. I was asked when I first got to Florida to help literally open and close the building for an addiction recovery group at my church. Right. So Dennis is a bigger guy, and they thought I could safely get there every evening when they needed me and open and close the building. And I was part of that group and listened into those stories. And Lou, the thing that struck me so impactfully over a period of time is that every story in that room was exactly the same. I don't care what your addiction is. You can pick whatever addiction you want, and it could be anything. And we all have something that we turn to, right? I challenge anybody that's on this call to say, I don't turn to anything when I want to go feel good, right? There's a million things that we turn to make us feel good, but so many of those things can do so much damage over extended periods of time. Even guys that do things like, I was in the CrossFit community for quite some time, and some people overdo even the exercise, right? They're healthy in some respects, but they were injured in other areas. And so anything that drives us to do something so we feel better can easily turn into an addiction. And so it occurred to me, what causes that? The story for every one of these people in that room started in a very similar way. It started with stress. Then I have a little bit of anxiety. And then I make some worse decisions or bad decisions, particularly. And this is where the precursor is, just like you see in pre-diabetes to diabetes, is sleep. Right. If I can catch you prior to you not sleeping properly and redirect your thoughts and change your behavior, bad things aren't as frequently happening. But what is happening for everyone that we know of with some sort of a disorder or struggle in the mental health space or emotional well-being, if you will, every one of them have sleep disorders almost across the board. And so if we can catch that early, I thought there's got to be a way that we can do something different. And so those were some of the thought processes that I had, and with the wake up call, like I mentioned earlier, we did this opioid wake up call. And that's what got me introduced to Dr. Mira that I work so closely with now. And he helped me understand kind of what was causing people to go down these paths and why the opioids were at the level that they were. I learned a lot of that through our industry and friends that you and I know. But the piece that struck me so aggressively is that I just realized that it's, opioids are one thing. And yes, you can see them in the claim spend. So we're trying to tackle that. But people didn't start taking opioids by accident. They didn't start some of these behaviors by accident. Everything, including the bad decisions for food or not going out and working out and exercising, all of those things start in the brain. And so it's so much farther ahead. But if you look at our industry, just like you said, it's working exactly as it's designed. Mm-hmm. The money is not in the prevention. It's always in the care.
Right.
So I was really struggling at a point. I would tell you that I met a client that is that's been very exciting. In fact, I'll give you the punchline at the very end. I've got a client that I was hired to help with retention. I was going in trying to install these strategies to save them money on their health plan. They were teachers, Lou, so teachers aren't overpaid. They are, it's a thankless job in many cases. They're raising our kids in some respects, right? There's all these political debates, because parents in some respects, I don't believe the schools are responsible for educating or I want to be cautious here. I don't believe schools should be making decisions for my kids. Let's say that.
Okay.
What I do believe is a lot of parents have checked out. And so a lot of schools are getting involved because the parents aren't involved. Because again, the parents are probably stressed and anxious. And so, there's all kinds of reasons. But I really, I'm a servant leadership type person. And I serve in a lot of these communities where it's nonprofits, and the underserved areas tend to be some of the places that I spend a lot of my time. And I wanted to help these teachers. And I love the organization, and the CEO has been become an incredible friend. And he's just doing really great work. And I wanted to support that the best I could. And so I knew if I could save him a bunch of money on his health plan, we could do some things, right? I didn't know exactly what, Lou, but I had his HR director very directly say, hey, we have teachers who used to give us long-term notice before they would leave, so it doesn't traumatize the kids. But in today's environment, now keep in mind, this was almost a full year prior to 2020.
Okay.
Teachers were walking in saying, I'm out.
I'm done.
I'm leaving, walking out the door, like middle of the day.
Right.
Stress was at this level, right? And so I don't think teachers are the only ones seeing that, right, or dealing with that. 2020 hit, and it just absolutely threw fuel on the fire, right? Like
Yeah.
a complete bonfire to some respects. So this school hired me to help with retention. Now, we just did an interview. The local news, because it was Mental Health Awareness Month, the local news did an interview with myself and my client. And while Tim's a good friend, he's also a straight shooter. So whenever they say they want to interview your client, you get a little bit of those nerves saying, okay, what's exactly
Oh boy.
he's going to say? The news isn't always a friend, right? So I was a little bit nervous, but I did mine. I told them kind of the story. It was very transparent about what I was trying to accomplish and the results that we had seen. And the cool thing is, after a year, we saved them about $250,000 in their medical spend.
Right.
They were able to increase salaries. They just announced Friday they're going to increase their salaries over $750,000. I was there at Christmas when he announced everybody's getting a full bonus because of the work we had done in the health plan, right? We had actively managed the plan and gave all that money back. But in the interview, he said the product that we brought to the table that we helped design, early 2020, there was a major catalyst for it. But a year later, he tells me that because we had plugged in a program called Emotional Vaccines, he actually had lowered his retention issues from an 18% turnover to 5%.
Wow.
In the last 2 years. And I saw that on the clip. My phone starts blowing up, and I'm like, I read it, and then I watch the video, and I'm like, Tim, how did you not tell me this? Because this is great information. I've literally got empirical proof, and I can prove now that a mental health tool, along with some other things, but a mental health tool actually can improve retention, right? We don't get to a bad headspace overnight. It doesn't happen immediately. It's a series of events. We don't gain weight overnight. It happens in a series of events. We're not going to correct it. But because of COVID, because tragically we lost a neighbor to suicide that was 13 years old. And then that happened after all the work I'd done with Dr. Mira, with all of the effort that we had put into it, after all the meetings I'd gone to and run into guys like you, Lou, and some of our peers, some of the people that I know you and I respect at the highest levels. I said, what are you doing for this mental health challenge that's growing, right? I contend it's a tsunami. I would even be so bold as to say that I don't think we have seen any of the fallout of COVID yet. I think it's still coming.
You're probably right.
And so from that standpoint, what are you doing for it? And what I got from my peer group, some of my most respected peers, I can tell you, was they would stutter. They might say EAP, and if they could change the subject and walk away, they did. That's what I saw from you. Some of the people that I'm talking about, Lou, and they're smart guys.
Yeah.
So,
well, you know what? You brought something up there, because it started with, let's face it, school is still a business.
Yeah.
Right. Most schools are probably funded with taxpayers' money.
Sure.
Right. Most, unless they're like a charter school, things like that, or, other not-for-profit. So there's not an unlimited amount of money, even for schools, but just think of the other businesses out there, right? So in the wake of this pandemic, most are still struggling. There's some that prospered just because of the nature of business that we're in. There's some that would shut down. Others are trying to figure it out. But it started with working with Dennis, who was able to save them a significant, you said $250,000, I think.
100 employees on the plan, actually 90 on the plan, and we saved them $250,000.
Yeah. And now, and part of the Health Rosetta, that we're in. I think you're right. Your health Rosetta, right? Yeah.
It is Rosetta principles for sure.
What are you going to do with that, right? We'll work with employers, but the ideal situation is we show employers how to build a high-performance health plan, eliminate all the artificial, costs, all of the hidden profits, bring that out of the plan, pass all of that artificial pharmacy back to the employer. What are you going to do with that money? And, because it's about the people. I mean, we serve the employers that we're working with, obviously, but it's about their people. That's why we're working so hard to do it this other way.
Yep.
But the result is a pretty significant savings. Yeah. Now you can do things with that serve your people and that business in many different ways. a good portion of it hopefully will be reinvested into the business. Because if that business can prosper, hopefully everybody within that company prospers too.
Yeah, to
So,
me, it's the best business retention strategy, right? I want my companies to thrive and grow and employ more people. So
yeah.
it's only in my best interest to do the best job we can for them, so they have money to continue to grow as an organization, right?
Right.
And that's the part that you don't hear people talk about as frequently.
So I want to talk. So under your traditional benefit plan, right? Your PPO or your EPO style benefit plan. Correct me if I'm wrong, but the 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 behavioral health specialists are specialists. So
Yeah.
you're going to pay at the very least your specialist copay,
Yep.
right? Way too many people are walking around with high deductible style plans where they have HSA, where they're paying 100% of the cost up till X amount,
Yep.
whether it's funded by the employer or not. But there's this extreme barrier to care for so many people.
Yep.
There's a million different combinations of how this works. One of the things that I talk about a lot is, the flexibility that self-insuring gives to employers, right? Because now you can control that plan document, you can build your plan, and there's a lot of things. And I would say that, treatment or access to behavioral health specialists within a health plan shouldn't be any cost associated with that, right? If you need to go speak with a specialist, whether it's inpatient or outpatient, once a week, twice a week, and you have a $40, $50, $70 copay, we're talking about hundreds of dollars a month that someone has to make a decision. Do I go get my treatment or do I not? Because the financial aspect of it, let's face it, money is a very big stressor. Money is at the core of a lot of anxiety and stress on young people, married people, people with children, all of that stuff. So in your tell me about that program that you did before.
So there's like three tenants, right? And I've got kind of two parts that have 3 points in them. So I'll try and keep them pretty simple, because I can go down tons of rabbit holes here pretty easily. But the three tenets that Dr. Meir kind of shared with me said there's three major issues in mental health, period. And one is just, stigma still exists. And I contend that as much as we're talking about it more, the stigma has not really reduced, right? If your kid shows some sort of a symptom, it has been on average 10 years before a person actually goes to seek care, right? So we deny it. We don't realize it's an issue. We're not necessarily educated on the issue. So because that we don't want to label our kids, right? There still is this massive stigma that exists in the market, and that hasn't changed. And I don't know that it's even moved significantly, even though we've had major athletes and Olympians and there's more awareness around it, but I don't know that the stigma's gone away. Who wants to be labeled? Who wants to take medication? Who wants to say, I'm going to see my therapist? Now, I do think in the next generation, Lou, like we've got kids and maybe even grandkids, that it's almost cool to have a therapist, right? So there is that movement coming, but it's not quite there yet for a lot of us, especially in the Gen X, that sort of, and our parents. I don't think it was even a topic that was, they were so hardened, I guess, World War II, just that didn't come up. So stigma is still a big issue. Education is one of the biggest, and that's really where we've been able to solve some things. So, the bad news is there's a tsunami coming. The good news is I do think there are some solutions that we found that work. So it's really in that education component. And then the third thing is access to care. And access to care is the one that still troubles me to this day, because my friend Dr. Meir is 60 years old. And if you don't want to work with my buddy from India that grew up in South Carolina because he's from South Carolina, and you said, Dennis, go find me another guy, there's not a whole lot of people out there like him, right? Mm-hmm. And we utilize him in a couple of very specific ways for our clients. And so I feel like for any employer, there's three tenets that you have to have. We've all been working with the triage side, which is point two. Point one is just understanding and education. You have to have some sort of a preventative tool to help people be able to recognize when things are going awry, when things need to be different. And so it's like that preventative education on the front end to help people understand and be more aware and hopefully reduce stigma, right? We do believe this program actually reduces stigma. The second is the layer that exists all over the place, but I still have issues with it that concern me dramatically because of what I saw during COVID. If the answer was EAP programs, right? You tell me, what do you think the average utilization of an EAP program is?
3%.
If that, right?
If
You're aware of it. So if that, I would say it's probably 2, maybe 1. And even then, if you go to the employer and say, hey, we need to put more money in mental health, and then the CFO starts looking at it and saying, well, what kind of utilization are we getting of the EAP program? Well, it's 3%. What's that end up in? Well, why would we put more money there? So, the EAP programs are dismally utilized. In fact, I contend, because of some of the challenges in the industry, they're designed that way to not get utilized, right? It's this thing that gets thrown onto your disability plan maybe, or on your health plan. They're not really designed to be utilized. And so that's what I saw during COVID. I saw situations where I had people that were close to me that were reaching out to their triage line, or that first tier of maybe they get a few visits. But in this situation, somebody was dealing with a spousal issue. If it had been suicide ideations, it would have been a bigger problem, but they didn't get a call back for 3 days, Lou. Like, if that's your kid that you're struggling with, or that needs urgent help, your only solution is to take them to ER and admit them for 3 days.
Right.
We call that in Florida a Baker Act, and that's happening. If you talk to any sheriff's department in Florida, one of the biggest issues they're having in schools is schools don't know what to do. A kid acts out. If they are going to harm themselves or others, they immediately get sent to the ER. If they really need care, that's the third thing, is that access to care. If they really need care, I will tell you, Tampa has got 3 major facilities for juveniles. But if you try and get your kid one of those beds right now that actually needs help, there's no beds available. So you know what they do, Lou, is they keep you in ER for weeks. Now, when you're managing the claim spend, the ER is much more expensive than the Holiday Inn, right? Way more expensive than the right facility. So not only are they not in the right facility, we're jacking up the health costs through the roof at the highest levels possible, getting billed whatever they want to bill us. And that's just bad across the board. And all you're trying to do is save the life of a kid. So that access to care is really where Dr. Mira has helped me. So what I tell all of the people that we work with, or that we talk to, or that we try and educate, and I don't care whether you steal and run with my ideas all day long, but you have to have a preventative tool. And I think I've got the only one that I've found in the market. If somebody's got something that they think is preventative, please do share it with me. I'd love to see it. But we call it emotional vaccines. There's an emotionalvaccines.com website that you can go check out. Employers, we have thousands of subscribers now. It started with Pasco County sheriffs and the school system. And so that's the one that we feel like is the education piece. But if you have an EAP, test it, right? It's that trust but verify. Make sure that they're actually giving your people the care that they want. But a lot of issues, if you finally decide to reach out for help, and it's been 10 years, think about that, Lou. If you waited 10 years to treat your tumor for cancer, how resistant to treatment would that issue be? So
100%, because you wouldn't be around anymore.
Yeah. Well, 3 to 6 visits of a therapist that might not even be a therapist. That's the other misnomer in our industry. Is I pulled up a major carriers network. We looked at 10 doctors. I met with my Dr. Mira to say, help me find the right person. And 8 out of 10 were not actually even MDs. They were therapists, but not even doctors, right? Most people don't know the difference between a psychiatrist, psychologist, therapist, and a freaking life coach, right? Lou, you and I can go put ourselves out there as life coaches tomorrow.
Yeah.
And in reality, it's kind of risky. So one of the things you said that I think creates the challenge is that access to care. I believe we want people to have that low barrier, just like you said, but I also believe there's as many bad actors in that world as there are good. And so you can throw a lot of money away at the wrong people. So that's where Dr. Mira has been incredibly valuable to me. And again, if we ever were to lose him, it would be a challenge, because there's just not a bunch out there. But I'm confident that there is more attention on this. So there are more and more things happening all the time. So there is an evolution. It's just not very fast. And I guarantee you the solutions are not growing as fast as the problems growing.
Right. Over my 30-year career, I can honestly say that the calls I get from members who are dealing with doesn't have to be a child, it could be it's their son, but a young adult.
Yeah.
That is facing a very, very serious mental health situation, could be at the point where thinking about, suicide, things like that. Those are the most uncomfortable calls for me, because I always put myself in the situation of the member. That's one of the things that just instinctively, when I get a call, that could be me. That is somebody. That is somebody's Lou, you
Yeah.
know. And it's funny, now that you mentioned it, there's been several situations. I don't know what it is about Florida, but where people from here, from New York, from the Northeast, always seem to migrate to facilities down in Florida, and they are almost never in network
Yeah.
for the health plans. They're extremely expensive. I don't know what I mean from your experience. What is a week in one of those facilities potentially cost?
It can be 25, it can be 50. It's across the board. I mean,
Yeah.
it seems it's egregious.
When you're in that situation, though, you're going to act.
Yeah.
That's your child. I mean, I'm sure if you're like me, there's no price I wouldn't pay.
Yeah.
I mean, there isn't. If I could, for one of my children, there's just no question whatsoever. What do you think about? I've seen a lot of like virtual solutions
I
for
think
mental health care.
I think it's good, right? But my concern goes back to, well, I'll give you two things. So going back to what you said before, right? You'll spare no expense. You'll send them to the facilities. I'll give you a secret that I was told through the addiction group. There are people in these homes, right, where people are struggling and they're staying in a facility, and they've had people who have been sent to addiction treatment centers, and literally the reimbursement rate for someone who's an addict is significantly higher. So they've had been reintroduced to an addiction because of the reimbursement rate. Don't think that that's not a very real thing. Anyone who's gone through that is aware of that. But from the flip side, let's see. Back to your question. Give me your question one more time.
About the virtual options that exist. Yeah.
Virtual to me is still, it's a little bit of a triage thing, right? And do you know anything about, do we do any work whatsoever to vet the credentials of the people answering the phone?
Right.
Lou, if it's your kid that needs help, like a lot of people have looked to social media. I mean, there's TikTok has an actual mental health, feed, right? And take a minute, go look at it. I would never want my children to see what I saw on that
Right.
site. When you can learn anything in the world on YouTube, right? You can teach yourself how to play piano. You can become a videographer. You can learn to play guitar. You can do anything on YouTube, but the one thing you can't do on YouTube is learn how to impact in a positive way your mental health.
Right.
And if you do find something out there, it's some therapist that's rambling on for 45 minutes to an hour about something you don't know, you don't understand, the language makes no sense, and
Right.
it's not as relevant. And then everything that I'm seeing is turning into an app of some sort, which isn't necessarily bad. But Lou, I was raised in Kentucky. If I'm super stressed, let's say I'm even acutely aware of the fact I'm super stressed, I'm not likely going to go log into some app and start yoga. That is not, or meditation. That's just
Right.
not something that's in my nature as a person. It probably should be, and it probably is for a lot of people. So I think all of these solutions are important. Telepsych, I think, is critically important because the access to care. The beautiful thing that COVID did is it did knock down some of the barriers for
Sure.
like Dr. Mira in Tampa to meet with somebody that's in New York. And there's, some of those challenges have gone away, which I think is phenomenal. But I would certainly always question, right? My wife's had a great therapist for a long time. She's been more than pleased. But there started to be some challenges. I started asking some questions, and I found out that she had actually never met with the psychiatrist. And I thought, in my own house, I know better. And I didn't ask that question.
Yeah.
I'm like, you're meeting with the nurse practitioner, which is not bad. Her person's good. But I did make sure she did meet with a psychiatrist because there were medications involved. And, you take
Right.
one medication, it's fine. You take two, and there could be interactions. You add the third, and the exponential component of interactions goes even higher, and take a vitamin, and it gets even worse. So how many of us are taking some pill to try and fix something, and it may be completely counteracting? That's why the psychiatrists have to be involved. The question I had this week, we vetted out in one of our groups, much like the group you and I met in. They said, hey, Dennis, we want you to jump on and listen to this solution. And we went through the whole thing. It was a great solution. It's doing some really cool things. But the first thing I asked is, okay, so you're helping give people some direction on where to go and what to do for their mental health issues. That's great. I was like, how many psychiatrists do you have involved? they didn't have one single one on staff.
Yeah.
I'm like, how can you, that's a big indicator for me. It's not that that's the be all end all, right?
Right.
But it's not a deal breaker, but you have to understand enough about what do our people need and how do they actually get care? And can you get ahead of it with an education tool, right? So that's the thing. There's so many things that I didn't know. And I'll share with you a personal story. So we had, you talk about COVID and it's just a different environment. Well, I've got 2 grandkids that literally they've grown up in the world they know. Masks fully exist in a lot of places, right? They're 2 years old and 1 year old. And so that's just part of their world. And that's what they know is normal. But my daughter-in-law is from Sweden, and she's actually a dual Russian citizen. My son met her a few years ago. They got married. We've got a beautiful granddaughter who's amazing. But my daughter-in-law is very stoic, and her Russian comes out in the parenting side. She's very straight-faced, and my son is much more like me, much more animated. And when you see the way she responds as a child, they're both great parents. There's nothing wrong with what Lisa does, but there is a very real emotional connection that happens just by making eye contact with a toddler at that age, the growth that they get or that they don't get. And so one of the tools that Dr. Mir gave me that I saw in one of the emotional vaccines was just to absolutely make direct and focused eye contact with an infant. And I shared that with both of my son and my daughter-in-law when this baby was very, very young. And it has changed how they reacted and worked with their own baby. It was incredibly valuable to me as the grandfather, because if you ask me in the world, like what's most important, it's my 2 grandbabies, right? So, it's the things like that we don't get a manual with these kids, right?
No.
I got a 27-year-old that has struggled with, with an addiction for the last 12 years. He's seeking treatment for now, doing extremely well. But we found out through his therapy that it was something that happened. It was a suicide that happened to it was my brother-in-law we lost 12 years ago. And I tell people all the time, I wish I didn't know what I know about mental health. I've been thrust into it against my wishes, right? But I see it. It's a growing problem. We see it in my own household. And Lou, I only have first world problems in my house, right? We are a blessed family, to say the least. And my son is phenomenal. Both of my boys are great kids. They're both great parents now. They're both functional, but we all have some level of something that we struggle with. And in his situation, we had no idea that the loss of my brother-in-law impacted my son the way that it did. We found out 10 years later.
Yeah.
So what do? Well, you start to educate people early. You start to help making sure that the resources that you're providing to your employees actually work. Pick up the phone and call that number and see if somebody answers, right? That's the least you can do to start. And then if you can get somebody like I have in your community, like a Dr. Mir that really understands mental health and understands bad pharmaceuticals and understands bad facilities and understands when people shouldn't be getting the treatments that they are and they're being taken advantage of, then you've got kind of the golden ticket. And that's really what's helped us with our school in a pretty dramatic way, is the fact that we are educating them and they are recognizing when an employer sends out a quick video. It's a simple series, right? It's 2 minutes or less of a video. That's all it is. It's no pain. It's all gain. It's not actually a shot. We recognize that it's got vaccines tied to it, which creates a little bit of political drama, if you will. But the reality is it is a preventative tool, just like a vaccine is. It's just it's on the well-being side, right? The mental health side. And it's a very simple process that he does that I love. He gives me the issue. He tells me what I can do about it, and he tells me what I get if I take action. And he doesn't force me to do anything. He doesn't measure how many times I watch the video. He doesn't tell me that I need to pay attention to it. But I'll tell you what it's done for me is I see pieces of it. I'll see a video here and there, and my kids will mention that they've got something going on. I'll be like, you know what? Dr. Mir said something about that. Let me share this with you.
Right.
Now, Dad's not telling him anything, right? Because Dad's dumb. What does he know?
Of course.
But Dr. Mir is 30 years, that's the credentials of Dr. Mir's 30-year duly board certified physician and psychiatrist. So he understands the physical side impacts the mental side and vice versa. And there's one big fact that we're all dealing with that I don't think a lot of us have realized, is the fact that major stress produces cortisol into our system, and over extended periods of time, even people that are going through life in a very positive way, like myself, can have significant health challenges. Women with heart conditions.
Yeah.
We lost a great lady this week that I tried to hire her for my team before I left my last career. And, she was way too young. She died young, and I don't know exactly what the issue was, but I bet you if somebody actually had a crystal ball and could look and really see everything that went on, promise you extended layers of stress contributed to it.
Well, life is stress. I mean, I'm in a similar situation. I thank God every single day for my family, the blessings, but it's still stressful.
It is.
Every day there's stress. There's stress, around work. You're worried about your children. My oldest will be 30 this year. I worry about him every single day. My daughter's 20. She'll be 21 this year. She works with me. I worry about her every single day. My middle son, he's a grad student from Boulder. He's an aerospace engineering student, and when he's going for his master's. He's got 2 classes left, and looking for work now. So if anybody out there's got a connection to aerospace, he's finally yesterday he finished his class. And he said, "I got to start looking for a job, and I'd love to get him out of my house." But when he was going to Georgia Tech, I flew down there 4 times in his 4 years that he was there. Didn't tell him I was coming because of the stress it was giving me, thinking about the stress that he was under.
Yeah.
Because there were so many suicides there on campus. It's one of the highest percentage. It's not a huge school. There's only I think there's about 16 to 20,000 students between undergraduate and graduate, but he was under extreme stress with the education. Aerospace engineering isn't easy anywhere, but it's the top 3 school for that. And I couldn't sleep. I don't think I slept for the 4 years that he was there because I was wondering what's going on with him. Where is he? Yep. What's he doing? What's he doing today? Because, is he over drinking? Is he doing too much today? Is he whatever? And I flew there, and he was a scholar athlete too. So he was playing lacrosse for the first 2 years, and that was adding a lot of stress because that was hours taking him away from his studies. Sure. And that was a whole thing. And I remember one time I got down there, and he was refereeing a youth game on the field there, and I just watched him for about an hour. He was having the time of his life with little kids playing lacrosse. It brought him back. He was laughing. He was remembering. His team was number 2 in the country when he was in high school. They won New York State championship. There's an excellent lacrosse player. And I had so much joy watching him play. And I felt the stress leave my body.
Yep.
And I watched him, and then the ball came near me. And he looked around, and he saw me from a distance, but he's like, and he turned away, he's running, he stopped, he turned around again, and he's like bent, looking closer. It's like, holy crap, that's my father.
Yeah.
And at the end of the game, we ran over to each other, we hugged and everything. And I stole him. I said, get your books, get your clothes. And I brought him to a hotel, and I said, you're asleep. I don't care. I don't care about any of this other stuff. You're coming with me.
Sure.
I think it was more for me than it was for him. He was fine, but I feel it just talking about it right now.
That's the difference. So that's one major thing that I've learned is we told all the addicts, right? The problem with addictions is they work until they don't, right? They raise your dopamine, but you always come back lower. So all these things we do to try and make ourselves feel better drop. The real secret to real serotonin and things that are lasting joy are relationships. Guys like you that I know genuinely care about my growth and your growth and the people around you, right? Real relationships. Because of, I don't want to blame social media, but the internet, call it whatever you want, but we're the most connected, lonely people in the history of the world, right?
Yes.
So that to me has become the secret of the success of these emotional vaccines is they are simple reminders of things that you probably already know that you need to go and do. You need to go see your son. You need to hug your babies. You need to, love on the people that are around you. Tell people that matter to you that they matter and make a difference. And when you do that, that gives you what you need, right? Be about something bigger than yourself, right? So I've got 500 things to do this afternoon, but it gives me some joy to know that somebody watching this, Lou, it'll make a difference, right? Yeah. I have a very genuine belief that the work that I've done over the last 4 years with the help of Dr. Mira and guys like you and partners who've helped me see the industry, I believe we've genuinely saved lives. And that matters. I don't know who they are. I don't know where it will matter, but I know at some point it'll matter, and it's helped me. But that simple story of going and being in person and hugging somebody that matters to you, matters to them, matters to you. It's honestly the simplest things in life are the hardest sometimes to execute on. And that pure joy that you get from that is as simple as that. I think we think mental health is this big giant problem that can't be tackled. And it is a big giant issue, but it can be tackled, but it's not going to be solved with some big pill. The government's not going to fix it. Healthcare is never going to get close to it. You have to fix it at home for yourself and take care of yourself, the people around you, and genuinely love people. And I think that's what it's those little things that make the difference. That's it. A lot of them over a period of time, just like, I always equate it to like the stress starts to fill up the bottle and I got to do things that reduce it. Right. That the constant, I never even know when I'm stressed out. When I learn it is when my wife says, you need to go take a friggin' walk. And it's usually because I was snappy or didn't pay attention to something.
Yeah. Well, it changes who you are, changes how you react to people. It's not something that's apparent. You break your arm, it, right?
Yep.
You have a blemish on your skin. You can see it. You can't see this, right? And because of the stigma, it's very difficult. And like everything else, if you can get ahead of it, that's the most important thing.
Yeah.
It's like obesity. Not everybody who's obese is because it's an eating problem.
Yeah.
Some people are going to be obese because of other underlying health conditions. But in America, our eating habits, all of these other things do contribute to probably, I don't know, I'm not a doctor. I'll look up the stats tomorrow and I'll have them for you, but 70% could probably be avoided by better habits, but they have to start with early, right? Diabetes, if you manage it early, you can avoid all of these other really ugly things that potentially could happen to diabetes, like amputations and all of that stuff. But you're not going to be able to eliminate all of it. But if we can have a proactive approach, eliminate the access to care, eliminate the stigma. One thing you said, and we're coming up on the hour, but one of the things that you said that alarmed me, and I see it myself, is the fact that, the stigma has its purpose, right? And I'm saying that not because stigmas are good, but when you have the other option where you think for young children, it's cool because some celebrity came out and said, well, now everybody has to have that.
Yeah.
I hear a lot of young people talk about, I have anxiety. I have anxiety. Seems like everyone I know around me has anxiety, and they might.
Yeah.
But I'm curious, how many of them really do? How many of them maybe have anxiety because it's an opportunity to get to that opioid? It's just I don't want that to happen. That's got a really bad side effect as well. So there's got to be a balance to all of this.
Yeah, mental wounds don't bleed, and there does have to be a balance. So, I don't know what the exact answer is. It's going to be different a little bit for you than it is me, but it is a similar path, Lou, very much, right? If I can help you mitigate anxiety and reduce your anxiety, I can reduce your cortisol. It's look at it, the same thing. If I need to go to the gym, I also have to find ways to reduce my anxiety. Going to the gym is one of them, but that might not be what works for everybody. So it's all combined. It is connected, and there's a lot of challenges, but there are smart people working on fixing it.
So, well, the cure for everything is get to the right professional, right? Because the right doctor, the right, if you have people seeing primary care doctors, they may be more likely just to prescribe medication because they're not as trained to identify the real significant cases versus the ones who just think it's, cool to have that, right? So that's why, just like everything else, we want to get people to the best doctors.
Yeah,
the best orthopedic surgeon, not just any orthopedic surgeon, the best cancer provider, the best, you name it, right down the line. Get people to the best doctors for that specialty, eliminate the barriers to get to those doctors, and things cure themselves. Not 100% of things, but the best doctors is really the key to everything. So I'm going to definitely reach out to you. I need to learn more about the emotional vaccines. I'm very interested in that.
Look out the website and I'll tell you, it's inexpensive. It's dirt cheap. Some of these things on the preventative side, if you don't provide some of these mental health tools, you're going to pay for it in the health plan anyway. You're already paying for it. You just can't recognize
There's
it.
no question. Right. No, absolutely. And you'll see it. So here's contact information. Anybody out there? Hopefully you're out there, or you'll be out there soon when we post this on LinkedIn. This is Dennis's contact information. He's not only, an expert in the area of, mitigating healthcare costs. He's a great advisor. He doesn't call himself a boo. I'm the boo. No one stole it from me yet. But anyway, thanks. It was a pleasure. Looking forward to seeing you soon. I don't know if you're going to be at Benefits Pro.
I've been looking at it. We've got too much travel going on. So I'm trying to stay home and take care of my clients, and we are still growing at a fast pace, which I'm happy about. So I'm trying to pick and choose, but Benefits Pros, I've got my eye on it for sure.
Awesome. Well, thank you. Good to go get involved in those other 50,000 things you got going on.
Thank you, sir.
Talk to you later, man. Thank you so much.
Take care.
Bye. Thank you, everyone. Bye.